Hi, welcome to the Dog Dave Show. We're pleased that you've joined us today. On this show today, we're going to talk about autism spectrum disorders. It's a condition which is becoming more common now, and I thought maybe we should bring the awareness to the public. People should know what the condition is. So with me in the studio today, I'm pleased to be joined by Dr. Pai. And also in the studio is Helen Adams. Helen Adams, she's got a son who's got autism. She's going to talk on the show regarding her life journey, managing her child, looking after a child, the challenges she has gone through. So it's quite a privilege to have you on the show, and we can learn from her. Helen, thank you so much for coming to the show.
My pleasure.
Right. You've had, I would say, hard times, I would say.
Oh, absolutely.
Absolutely.
Yeah.
How old is your son now?
He's 21 now.
He's 21 now. Yeah. Is he still living with you?
He does still live with us.
Yes.
He's in the next, hopefully, 3 months.
Yes.
He'll transition into independent living, so he'll actually move out.
Yes.
So Soren has high support needs. He's non-verbal, and would be classed as having severe autism, but we've made the decision that he will move into independent living. So he'll move into his own little house, and he'll have support workers that will look after him.
Well, he's an adult now. He's 21.
He is an adult, and he's actually definitely showing signs that he's well and truly ready to make the move away from mum and dad and actually have more independence and more of his own life. And I think I'm quite passionate about that. It's actually a good thing for him to not live at home with us forever. That the older you get, the more you are actually just holding your children back when you don't actually allow them to. Right.
I'm going to take you back. You had normal pregnancy. Did you have any problem with pregnancy?
No,
with your son?
It was very much a bog on. He's my first child, so definitely no issues.
No issues.
I had a tiny bit of swelling in my feet and hands in the last month of my pregnancy, but normal in all other ways. And he was a normal vaginal delivery. There was no complications. They said it was normal. It didn't feel very normal to me. But I'd never had a baby before, so I didn't really have that much experience to go on. He then progressed to, he pretty much cried. I felt like he cried for the first year of his life. It felt like he was crying more than he wasn't, and he definitely cried and was unsettled more than any other baby I had ever had anything to do with. And granted, I didn't have lots of experience with babies, but he was definitely, looking back, I can say that absolutely I knew there was something wrong from quite early on.
Quite early, you're saying you noticed something was wrong. At what age was he then?
He was probably, I could definitely say at about 4 or 5 months that I knew he wasn't your stock standard ordinary baby. He stopped meeting his milestones. So and this is probably actually his, because he also has mild cerebral palsy. So it was probably his cerebral palsy that was actually showing up at that point in time. The unsettled bit was the bit that I link back now to him being autistic. But he couldn't roll over. He couldn't lift his head up. He was very floppy as a baby. And when he was 9 months old, we saw our first paediatrician and started having testing done to try and find out what it was that wasn't working.
Did he crawl at the right age?
No, he never cross crawled. He pretty much, he had a lot of early intervention. So we saw a physio and a speech therapist and an OT as an early intervention group from pretty much probably when he was about 12 months old for a good year that we saw them, and then we actually went to another outreach program that came up to our small town that we lived in. And he just went from sort of commando crawling around the
Yes.
place to walking.
Walking.
He didn't ever cross
Yeah.
crawl.
But walking wasn't a big issue then?
No, once he started walking, he then fell over everything,
Yes.
climbed on things and fell off them. And now he's actually very cautious when he comes to anything where he stares or anything like that. He's very safe, or tries to be, because and I think it goes back to that falling over everything. The poor kid, he was really a bit quite clumsy. But at that point, we still didn't know. Like, he was 9 before he was actually diagnosed as having mild cerebral palsy. So
He was 9.
9. It was only when his feet were starting to really turn in that actually came out. But I know we're actually talking about autism today, and he was I think 4 when we finally got the diagnosis.
Yes.
The first and this is obviously quite a few years ago, but the first paediatrician that we saw really didn't seem to believe that you could be autistic unless you were sitting up against a wall, bashing your head up against it all day, every day. Like, that was what he had to be like the most severe type of autism for it to be autism. Now we obviously realise that it's a whole spectrum, and you can go from quite mild symptoms, outward symptoms, to quite severe ones. But Soren was very uneasy in large crowds. He didn't like Christmas. He hates opening presents. And it seems to be more. There's lots of people. There's lots of emotion. He's very picks up on emotional states really, really easily. So that can be quite difficult at family gatherings and things. And if you had to take him to a party or anything like that, we just didn't attend lots of things that we could have, because we knew that it wasn't going to work.
Right. So when the pediatrician diagnosed with autism at the age of 4, how was the impact on you as parents?
I already knew that he was not ordinary or normal, in inverted commas, if whatever normal is. So that diagnosis was more okay, yes, someone finally is actually acknowledging that it's more than just an intellectual impairment.
Right.
That there's actually there's autistic behaviours there.
Yes.
So it wasn't. I don't feel that it particularly changed anything for me. I don't know.
And your husband, the same thing?
He's always been fantastic with the fact that we have a child with a disability. He was never had any ego about it, or felt that there was something wrong with him. I think lots of people struggle with. I probably struggle with that more than he did. With how did that happen? There's something wrong with me that's caused that to manifest.
That's right. That's the most scenario we hear, let's say in our clinical job. The parents start to blame themselves. That they are doing wrong.
What did I do? Was it that
I wasn't smoking? I wasn't drinking alcohol in pregnancy. Everything went well.
I didn't do any of that sort of stuff. What caused this to happen to me?
You can't get the answers. Which is the frustrating part, isn't it? So you breastfed him and all the stuff.
He was fully breastfed. So he also has lots of food allergies. So he's quite intolerant to gluten and to dairy. So he has a diet that doesn't have any of that in it as well, and that the dairy has just always been. He's always not coped well with that, and the gluten. There was a bit of a thing there for a while where put your autistic child on at a school that he went to. One of the teachers said try him on gluten free, because they were saying that gluten causes brain fog and causes kids to not be able to concentrate as much. And I never really I put him onto that diet, and it actually just helped his digestive system a lot. I don't know that it particularly made him any more alert or any of those issues. But if he has anything like that, it makes him unwell now.
That's right.
So
Okay. Dr. Pai, thank you so much for coming to the show. We appreciate that. The autism spectrum disorder is one of your passions. I know you are a child and adolescent psychiatrist with special interest in autism disorders. This condition is becoming more prevalent, now more common. Like I was checking some of the papers, they're saying now at least 1% of the children in England are affected by the condition. Of course, it's a spectrum. It's a whole group of them. Like Helen was just saying, I mean, the severity is different, is variable. Is there any explanation to why is this so? Now we got more of autistic diagnosis.
I think there has not been a spike from what I can see, and what I read is it's not about suddenly there is more people who are suffering from the condition, but it's more about the awareness of people and awareness of the general public and the teachers. They are the main people who tend to pick on these conditions. Previously it used to be, this is a child who is not interested in friends, or this is a child who should not be with doing things. And now they are saying, oh, the child is different to other children. So what may be the reason for that? And a lot of the time it is about blaming it used to be about parents, or they may not have given them a warm childhood. And even before, with regards to mental illness, schizophrenia, there is this double bind theory wherein you blame the mother or something about the childhood. So it was, a lot of the time it was not, eyes don't see what the mind doesn't know. So if you didn't know, then you don't tend to pick it up. So now I think people are becoming more and more aware, and that has led to the increased spike in diagnosis. And more so, I guess, there is effective strategies and support available. NDIS, the National the Disability Insurance Scheme, has recognized, and autism is one of the diagnoses which comes with the financial support, so that it helps the families and the children. And I think all of that makes parents visit the doctors and go through the diagnostic process, and also additional support in school. So when something like that is happening, more and more people are okay with the labels. Sometimes labels can be,
sometimes they're effective, sometimes it actually gets you support.
So exactly. So that's where so people wouldn't want a label, just if it means that that's a bad child or you can't do anything about it, what's the point? But when there is support available, people are coming forward to say, can we get our child tested for this?
Yes, that's right. Coming to the diagnosis criteria, there's two criteria you use in the ICD-10 and the DSM-5 now, and you have to fulfill both tests, is that right?
I think with regards to the diagnosis, I think the ICD-10 is going to evolve into ICD-11, and most of even the NDIS funding and the more recognized one is the DSM-5. It is the most latest. But to do the diagnosis, the tests are different. You could do a test, video study called ADOS, or a long diagnostic interview called Autism Diagnostic Interview, or DISCO. There are different names and types for that.
That's right.
And it's just not about the psychiatric aspect. The diagnosis needs to be multidisciplinary. You need a speech and language therapist, psychologist doing an IQ assessment, an occupational therapist. So last year, the Australian government has come with the National Autism Guidelines, which is fantastic, and which I think brings everything under one umbrella to see what needs to happen with the diagnosis, treatment, and moving forward.
That's right. And like Helen was saying regarding your child, he's got cerebral palsy as well. And it says here about 70% of the children with autism, they also have got some other intellectual impairment as well, like learning disability, for instance. One of the ADHD is another one. Is that always the case now? So you see that a lot?
drew me to autism because I'm a psychiatrist. I'm a child and adolescent psychiatrist, which means that I see children pretty much under 18.
Okay.
And by the time, Helen was one of the few lucky ones who got diagnosis before the age of 6, because most of the diagnosis in the early years is done by the pediatricians and with the multidisciplinary team. And that's good when they get diagnosed at that age.
Yes.
But sometimes they are flying under the radar, especially so with girls. So by the time they come to see me, when they're 8, 9, it's very rarely with autism. They come in with school phobia, not being in school, social anxiety, ADHD, depression, even at a later age, at an older age. So you're right. 70% of the children with ASD have got a comorbidity, by which we mean that there is some other mental illness or a condition which goes with that.
Yes.
And the commonest one being the social anxiety, ADHD, then the intellectual impairment, and as the child gets older, depression and other conditions. And that's where it becomes so important to diagnose ASD, because the treatment would be different.
Yes.
If someone is anxious or depressed, you would say you need to go for talking therapy. But
You're not going to want to talk. It's like,
it will be like pulling teeth, and people are like, oh, the child doesn't want to get better, the family. So people are left holding. But so we need to find ways to support the child. So that's where in recognizing ASD becomes very important. Right. Then we might be able to help differently.
Yeah. Now we're hearing a lot about autism spectrum disorder. It's a spectrum, of which you got autism itself as one of the categories, and then we got the pervasive development disorder, and we got Asperger's now. I don't see much of the Asperger's. I don't see much of the pervasive development disorder. I only see autism. Is it because we're not picking up more of the other ones, or?
I think it is wherein the diagnosis becomes helpful. The DSM-5 has got rid of Asperger's, because especially when there is a lot of research and stuffs going on. Asperger's was nothing but children with autism spectrum, wherein the speech development was normal. Because one of the main things with the autism is that there is social and communication difficulties.
Yes.
Then there is qualitative difficulties in speech and a delay in development of speech. And then repetitive and stereotyped behaviors, whether they get flap their hands or they get very obsessive with regards to things. So those are the three main things that was required. So they have tried to streamline, there's no point in splitting hairs with regards to the diagnosis. It adds to confusion, because
where do you draw the line with someone? Is someone got Asperger's, or have they just got autism? Well, they've all got autism. At what level do you say, well, you're no longer high functioning, so we call you Asperger's. You're lower functioning, we call you autistic. It then, like, to have it just as autism across the board I think it takes some of the stigma away, because it was sort of like, well, I'm Asperger's, so I'm a bit better than you. You're just autistic. Right. Yeah. So they did away with Asperger's as a label, and just put everyone under the autism banner.
Yeah, that's right.
Yeah. And I think I don't know what your experience might be, but the more severe, the almost sometimes as much as it is an awful lot to bear for the person with the disability and for their family, it's much easier to say, yep, there's definitely something wrong there. Nice big tick for you. You get support and you get some funding. And not that we had much support before the NDIS came in Australia, but you at least got something.
Yeah, that's right.
If you were more high functioning and but had crippling social anxiety, you would often get very, very little or no support. Right. So there were lots of people out there, and probably still are, who were absolutely struggling through each day with very little support, just because they could speak and outwardly appeared to be able to function, but inwardly barely able to get themselves to get out of the house.
Yeah, so your son is now 21. So over these years now, since the diagnosis, he needs a carer for 24
he
hours.
needs someone with him. He's
24
not. He's a. You couldn't leave him by himself.
By himself
he
at
would be
all.
a safety risk. We have our front door locked, so that a screen door locked, so that he can't exit the house because he has shown repeatedly that he will go out onto the road. And he doesn't really have a whole heap of road safety sense.
That's right.
Yeah.
So the impact on you as a couple now, were you working one goes and shifts or kind of work to look after him?
We have certainly haven't got the perfect marriage. There's no such thing, but we have always worked as a team. When it came to the care of our son, and everything that we did with him and his best interests in mind. So even just the other night, my husband stayed home, and my younger daughter and I went out for a couple of hours up to the Christmas street fair. And so he just didn't come, and he stayed home with Soren. So we do that a lot. That if we can't get someone, or it's last minute things that you just don't get to do, because you can't get a carer necessarily at the last minute to actually come and assist you. So there's lots of stuff that we just don't do together.
So what has been the greatest challenge for you looking after him?
Probably supporting my younger two children, and making them feel as if they were just as much a priority as my son was. So it just stands to reason that you need to spend a lot of time sometimes caring for someone who's having, he can have 3 and 4 meltdowns within a 1 hour period if there's something that's not quite right for him. So, and that takes up a lot of time. And my girls are both older now, so and have a great relationship with my son, and are able to understand. But certainly, when they were younger, there were times where they would say that everything's about him. Everything's about him. There's nothing about us. So that juggle of actually making sure that they still felt loved and supported and spending quality time with them.
How many other children have you got now? Two other
children. So my son's the oldest, and then there's 2 girls, so 2 years younger than him at each space. So
And they don't have any issues at all.
No. I think possibly my next one down from my son may be on the spectrum as well, but I didn't notice it because she spoke quite well, and there weren't a lot of developmental issues, but she has quite significant anxiety, and I do wonder but getting her to actually, she's now 19, and getting her to actually go and see anyone or talk to anyone about it is not happening just yet.
Not yet.
I don't know. You might have some ideas for me for how I'd actually get her to be, because I just know that she's not getting as much out of life as she possibly could. My youngest daughter just finished grade 12, so she's just finished school, and I don't see any issues with her. And I have always been very open with them about what the challenges are of having a son with a significant disability, and allowing them to actually voice their own issues as well.
Yes, that's right.
Yeah.
Dr. Pai, so again, it turns out having a sibling with autism, for instance, is a higher risk. I mean, is a predisposing risk for the other siblings to have the same condition. It tends to run strictly in the family. It's hereditary. I don't know, any other risk factors you've noticed apart from the sibling relationship?
I think that's where the most people are fascinated is about there is so much not known about this condition. And people have gone round in circles with regards to what could be the etiology, but what we know, it is a neurodevelopmental condition that people are born with it. It is not anybody's fault. There was this a few years ago about MMR vaccine, or that could be, and that research came about. So many children didn't have jab and now are having measles and other risk factors. That has been discredited, that research. So that is the most of the time when we diagnose someone with autism, either one of the parent would be able to recognize when we are going through the questions, that was yes for me and me and me. So usually we may be able to see that one of the parents might have more of the traits of the condition. So when someone doesn't meet a diagnostic threshold, then we would say that they got traits. They just may be just socially anxious, or they may be having some of their own quirks of how they wanted to do, how they like to organize. And that is the bit about, half of the genes come from the dad, half from the mother. And when the child gets it, how it is organized and what is manifested.
Yes. Because we see when women are coming out, they're preparing for conception, or to have a child, they're preparing, they're saying, do I pose any risk to a pregnancy? Am I okay for pregnant? I want everything checked. I want everything checked out. Or even during the antenatal care, we do scans and looking for some developmental disorders. So people get more anxious now. Am I going to have a disabled child? Which we can't say it's going to be. We don't know. Like you say, it's a neurodevelopmental disorder. We can't explain some of these things. So coming to you, Helen, now, supposing we got a family maybe watching, they got a child who's maybe got some autistic traits or just been diagnosed with autism. They are saying, we're burned out looking after this child, or they're facing the challenges. They can't get the answers. What caused this? What could be? Is it me? Is it my husband? Is it what? They just self-blame, basically.
Yeah.
How can you motivate that family from your experience of 21 years with your son, who's now 21 years, now about to live independently with 24-hour care though, but you've gone through all the emotions that go with it as husband and a wife, and you're still together. Because I've seen some other couples, maybe they split. They actually have divorced because now they can't manage the child, and this puts stress or strain on the relationship itself.
It certainly does.
That's right. Yeah.
I think having any child, whether even if they're absolutely you could tick every box, they're all normal, is actually put strain on your relationship anyway. Adding a disability into the mix can certainly add additional pressure to a relationship, and lots of people's relationships don't last. I actually did a bit of research, and there was it's an urban myth apparently that 80% of people with a child with a disability split up. That is actually not correct. It was a very small study that was done on, and there was a much bigger study done in the US that disproved that, and the rates of divorce for if you had a child with a disability to if you had no children with disabilities was about the same. There was a tiny bit higher in the people with either an autistic child or just a disability in general, but it wasn't actually that much worse than just the general population. But I do, like, as far as if you've just received the news, you probably already have been living with it for a while, so the diagnosis should actually not be seen as a negative thing, because like we said earlier, sometimes labels get you support. And what you need more than anything else is to actually be supported. I would not consider that I'm any sort of expert in autism. I'm an expert in my son, and I think that you need to go back to that as a parent. You're an expert in your own child. You know your own child, and autism is a massive spectrum. So what one person might tell you is, well, this worked for me, is not necessarily going to work for your child. You know your own child better than anyone else possibly can, and you're the expert there. So it does create a burden then that you're responsible for actually getting the best possible outcome for them. But it's also just about putting one foot in front of the other each day, every day. And if it's a really tough day, then you've just got to get through that day. And it's a new day when the sun comes up the next morning, even if there wasn't much sleep had the night before. The sun still comes up the next day. Definitely do what you can to get as much support as possible. If you've got family that you can actually connect in with who will support you or who will actually help you with the caregiving, especially for really young children, if they can help you. You need to get over yourself if you think you need to do it all, because you don't. And you will be much more burnt out if you keep trying to just do everything yourself. So definitely seek support from any and every avenue. Lose all issues you might have with asking for help, because it's not a negative thing. It's not something that you should feel bad about. You are struggling with more than what one person needs to cope with.
That's correct.
And for some people, my son, for a lot of people, they would say, man, that's some heavy stuff you're dealing with there. You can always find someone who has even more to deal with. So, there are some families out there who every child they have has, severe autism. So they might have not known to start with and had quite a few children, and then they're left with lots of people who they're needing to actually provide lots of support for. Early intervention, the earlier you can get them support, the better.
The better.
Keep going with therapists until you find ones that actually work for your child. I always said my son can smell a therapist at 100 paces, and he doesn't like structured therapy. So, and I think that's just he had some negative experiences with it when he was really little, and it was too forced and too, you must do this, and that type of behaviour has never worked for him. So he has some fantastic therapists now, especially speech. I don't know, you might have something to say about that as well. As for speech, because autism is such a communication barrier. That's that and your sensory overload. But yeah, getting those sort of therapies in, picking the right school for your child. Every child will be different and need a different approach. So there's no one size fits all for any of us. But when you add autism to the mix, it adds a whole another level of uniqueness to that person. And like for our son, he went to a special education school for most of his schooling, and that worked well for him because it was smaller class sizes and less disruption, less people going around, and just less kids in general as well. For some people, it's going to be a mainstream school with just some extra support that might even be able to be cut back as they improve. For other people, they might want to homeschool, but it has to be what will actually work for your particular child. And it's okay to say, this isn't working. I need to change things up, do something different.
Well, that's a very thorough summary of autism.
I could talk all day.
I can see that you've done some research and everything, and I'm sure that has bolstered your self-esteem as well. It encouraged you, you stayed confident and resilient. But the more you did the research, you tried to pick up bits and pieces to suit your son. And to have a model about managing or looking after your son, that has given you the confidence to do that. So you've done wonderfully well, to be honest. I like the encouragement. Everybody's different, obviously, so you need to know your child, your own child. It's unfortunate, some families I've seen that they got more than one child with autism, which is very unfortunate. But
it just adds another layer of complexity.
It complicates the situation. But the main thing is to stand together, husband and wife, or if you're a single parent, regardless, you just need to find some help. There is help out there.
Yeah.
You know your child, do the best you can, and know your limits. Getting burned out, you have to look after your own health too. So you need to seek help when it's necessary. You got to recognize that. If you're not sleeping every day, you may not talk to a doctor or health practitioner. Get some help in that area.
Yeah.
Dr. Pai, anything coming up in the horizon in terms of research?
I think with regards to autism, it is because it's a disability. You don't have a treatment or a cure for that condition yet, and most of the time, what is, and still there is a lot of work needs to be done with regards to the awareness and the knowledge around that condition, and there is help there, but I don't think we are getting enough people recognized and identified early enough so that it can make a difference to their lives. So it is not about what more needs to happen to the condition, but it is about already people who are having the condition and who are living with it, but possibly they themselves don't know, or the families don't know how we can get better at supporting those families.
So it's about maybe if you got a child, a family, maybe you got a child there, recognize like what Helen did, Helen, the husband, recognize that no, there's something wrong here, and to cry out quickly and say, no, there's something unusual here. The child isn't crawled. There's some weird behaviors. I can't understand them. We see that as a general practitioner. We see that we get a letter from the guidance counselor from the school or something. They say, oh, we're concerned about A, B, C, D, and all this stuff. You say, oh, sometimes the parents will say, no, I don't know. No, at home he's fine or she's fine. They're trying to defeat. They don't want to accept that there is a situation. We've had scenarios like that. But we appreciate that, the schools and teachers, they listen, they look at these things, and they to try to guide, say diagnosis in the right way, send to the GP with a summary, and we take it from there and we refer to the appropriate professionals, which is very good. So yes, recognize or increasing awareness, I think that's very, very, very important.
I think you only ever do your child a disservice if you don't, if you pretend that there's nothing wrong and just keep pretending and moving forward. You are not you're not helping them in the long run. You're only making their life more difficult. A denial won't stop it from being. It will still be there. I don't know. Do you see many people who the parents are wanting it to not be?
It's quite, I think once I work it out, like you rightly said, what I see is, I know a bit about mental illness, I know something about autism, but what I'm learning is I'm learning their child through the parents' eyes and seeing what they're going through. And a lot of the time the denial is about feeling blamed as a parent or feeling that it was something their fault. So the moment the teacher says that there is a difficulty, I think there is something which a child is different to other kids, or a lot of the time the parents from very young, from prep days, these parents would say that going to the school is so anxiety provoking. Every day the teacher says, your child beat this child, did that, they had a meltdown in the park, we can't take them here, we can't take them there, and it becomes so overwhelming to be even able to consider that there is it could be a condition, it is not their fault, and there is help available. And diagnosing condition is possibly, I can say, the easiest part, but what happens afterwards, the real journey starts. And for the first 6 months, the parents go through the grief cycle. It is like they go through all the cycles of grief, the guilt, the anger, the shame, until I don't know what your experience was, but
when Soren was a baby still, I went through that, probably when he was, from about 1 to 18 months. So it was definitely had a bit of a dark period.
So that's mentioned about dementia, autism, it's like you lost something, and then having to then come to terms with it. So that's what I see. After diagnosis, the first 6 months becomes very important for families and parents just to be able to see things differently and rebalance themselves
Yes.
and go on a different path.
Yes.
Till then, this is what it is. And I think being a parent, I see, is the hardest job in the world.
Yes.
There is no manual that comes with it.
No.
You need to be able to work with your child.
Yeah.
Yeah.
And everybody is an expert in parenting. You go to Coles, Woolworths, your child is there,
They're having
the
a meltdown
looks,
and
the looks
and
that you get, and you are just like,
And
I can't.
that's the other thing with autism, like for most kids who are autistic, they just look normal.
Yeah.
There's nothing,
Yeah.
there's
But
no,
the
there's
parents-
no sign above their head that
Yes.
says, pardon me, I'm autistic,
Autistic.
I've thrown myself to the ground for a perfectly good reason. I've reached the tolerance level I have for society, and now I've lost the plot in the middle of Coles.
Yes.
Because it's too bright, there's too many people, there's too much noise, there's
Yes.
Christmas
The
carols.
tenor
singing.
is just
Yeah.
continuously
Yeah.
blaring out offers.
Yeah. I can hear the humming of all of the lights in the ceiling that the rest of us can't hear.
Yes, yeah.
For some people, they can hear those fans going above us would be too much
Yes,
for some people.
yes, yeah.
So all
Yeah.
of that stuff that's just a stimulant that we barely even notice.
Yes.
For a lot of people, it's just that sensory until they reach a point where there's no holding back, and they just have to have a
Wow.
meltdown to get rid of the energy.
Wonderful, wonderful.
Unless you're in there.
No, yeah, that's very good.
Yeah, I do think a lot of people are. I hope it's getting better. That people are more aware that if someone's child is completely losing it, that I can remember thinking, oh, it's so embarrassing. I just need to get him out of wherever I was. And now I see other people going through it with a toddler or a little child, and it's like, oh, you poor thing. But I don't think, oh, take that child home. Why did you even bother bringing them? Because sometimes you have to take them somewhere.
That's right.
Like
yeah.
and no one, just because you have a disability, should have to be hidden away.
No.
Because those times are hopefully all gone, where we just hide the disabled people over there and pretend that they don't exist. You want to see everyone out there
Yes.
and being part of their society. But yes, society maybe needs to move forward.
Yeah. Well,
The parents come with loss of confidence. They come with, that's the main thing. They're unable to say that, but they are looking at us as experts for answers. And my job is about giving that confidence back, saying that nobody is going to know your child more than you.
Yeah.
I may be able to, I see a child maybe an hour a week, but you are spending the hundreds of others hours with that child, and I will not be able to provide those answers for you. So
Yes.
you are the one who is going to work, I'm going to work with you to find answers
Yes.
along with you, which will work for you as a family
Yes.
and as the child. Each family has got different values, different sets, so I can't take off the shelf and say, this is what you need to do. I
Yeah.
need to understand
Yes.
Yeah.
where they are coming from. For some parents, maybe going out in the playground or child coming home at 8 o'clock just for dinner is okay. For some other people, no, this is not okay. You need to be home by 6, you need to do this and that. So each family's values and things are different.
Yes,
And
different.
my initial work is about getting that confidence back in the parents, saying that I'm not blaming you. Nobody should be even be blaming you, and you shouldn't think like that.
That's
Yeah.
right.
So
Yeah. Yes.
Yeah, so awareness, that's the whole point, isn't it? We want more awareness of the condition. Now, because it's now more widely accepted because of the National Disability Scheme now, and more people are coming out and
Yes.
saying, no, we need a diagnosis. There's something wrong with my son, or something.
Yeah.
They want a diagnosis, you see,
Yes.
because now there's extra services available for that,
Yeah.
which is very important anyway. So, Helen, wow. I don't know what to say. Thank you so much for all
My
this
pleasure.
detailed summary about how you've managed your son. We appreciate that.
My pleasure.
Heads up, and I'm appreciating encouragement to other
I hope
family
so.
members there,
I hope so.
with the parent there who say, no, I've given up now, or they're emotional all the time, self-blaming, and maybe end up with depression and other things,
Yeah, it's definitely a
Yeah,
process you have to
that's
work
right.
through.
Yeah, so hopefully that has encouraged somebody. Okay, we appreciate your coming. Dr. Pai, we appreciate that. your knowledge, your wealth of knowledge regarding this condition, whatever you're doing. I got to know you because some people are talking well about you. So appreciate that you've come to the Dr. F show, and we thank you for what you're doing in the community. So both of you, thank you for coming to the show. And everybody else, thank you so much for joining us on the Dr. F show. We hope you've learned something. Just being aware of this condition, which we try to explain. Keep well, keep safe, and God bless you. Bye-bye for now.